Welcome back to Open Med School. Today I'll be discussing another case of hepatic encephalopathy. Let us imagine a 55-year-old man who is a non-cirrhotic comes with confusion of 1 day duration. His wife says he was normal few days or 2 or 3 days back. How will you approach this patient? We have defined hepatic encephalopathy. The grades also we have discussed last time. Hepatic encephalopathy is common in cirrhotic patients. It can occur spontaneously or due to some precipitating factors. Most often, there is an underlying cause and there is a precipitating cause. Today, we'll be discussing the precipitating cause little more detail. So, what are the common precipitating factors? Most often, or one of the most important thing is upper GI bleed. So, in any patient, you should ask about melena, infection, spontaneous peritonitis, urinary infection, and pneumonia. Electrolytes are very important, especially hypokalemia, sometimes hyponatremia, metabolic alkalosis. Some patient has got vomiting. This may lead on to. I have discussed about the role of kidney and the development of hyperammonemia, renal failure, hypovolemia, hypoxia, sedatives, especially benzodiazepines, because GABA is one of the neurotransmitter that is said to be involved in the development of hepatic encephalopathy in addition to ammonia. Always rule out hypoglycemia, constipation. Very rarely hepatocellular carcinoma and vascular occlusion, like Budd-Chiari portal vein thrombosis. So, precipitating causes to be evaluated, investigated in detail. So, how will you identify the precipitating causes? First and foremost is history. Ask about history of medications, sedatives, use of alcohol, GI bleeding, melena and hematemesis. Examination look for signs of bleeding, post hypertension, the evidence of dehydration, dry tongue, low BP, tachycardia. What are the investigations? You go for CBC. Hemoglobin low, anemia indicates GI bleed, probably. Check for the liver function test, renal function test. Electrolytes, acid base, because hypokalemia is an important thing. For infections, look for blood, for culture, urine culture, and exclude spontaneous bacterial peritonitis. And a urine screen for drugs, and never forget GRPS, because liver disease can lead on to hypoglycemia. So these are the minimum things that you look for to identify the underlying causes for and also for the precipitating factors. Then we will think about few important points. Why does GI bleeding cause hepatic encephalopathy? The reason is this will lead on to increased protein load. That is a very good contains protein, and this will lead on to breakdown of protein, development of ammonia. So that is the reason. How does hypokalemia and metabolic alkalosis worsens? So this will facilitate ammonia into the passing through the blood-brain barrier. Why do sedatives matter? Here mentioned there are neurotransmitters, osmotic effect producing cerebral edema, and many false neurotransmitters, mercaptans, fatty acids, etc. are also there. Another important thing is benzodiazepines, either endogenous or exogenous. So sedatives, especially benzodiazepines, are notorious to precipitate hepatic encephalopathy. So the important point to be remembered is always search for precipitating causes. Hepatic encephalopathy is a diagnosis of exclusion. Always remember the precipitating causes, rule out other causes, especially hyperglycemia, electric imbalance, and infections. And think about the differential diagnosis. Is it a really hepatic encephalopathy? Indicates like subdural hematoma. The patient is not improving. Definitely go for a CT scan. If there is a history of trauma, history of focal deficits, sudden iteration, not improving. Go for imaging. CT scan is sufficient. And rule out renal failure, because kidneys are one of the organ that excretes ammonia through the urine. So when the renal failure occurs, there is increase in the ammonia level increases. That is a point to be remembered. Other cause of delirium. Always remember the AEIOUS. So details will be discussed along with delirium. Sepsis, hypoxia, stroke. In young patients, keep in mind the possibility of Wilson. So in short, hepatic encephalopathy occurs in cirrhotic patients and there is an underlying cause. Look for the underlying cause. In young people, always remember Wilson's disease. Look for the precipitating factors. Stay tuned for further sessions. Thank you.